Hello, Dr. Pelto here. Thank you for visiting. I'm going to talk a little bit today about plantar plate tears. This is a painful problem that happens to a lot of our patients in the front of the foot. And I want to go through a little bit about kind of what causes it, what are some of the treatment options for you if you're seeing a podiatrist for this. First, I always like to ask my patients, and I'd like you to think about this on your own. How does this impact your life? Basically, if you've had a plantar plate tear, you've probably seen someone because it's not a easy diagnosis to find. It's not something that you can Google and find. You're probably seeing a doctor, and it probably causes you pain, frustration. You can't walk for exercise. A lot of my patients get weight gain. They have a fear of surgery, missing out of work, and can't be as active. You may have other things, but it tends to affect people's lives. I have a patient currently that's dealing with a plantar plate tear, and it's hard because she's always on her feet at her work, and she really just can't stay off it to try to help it to heal. And we're going to talk about some options. And I think it's key to determine how long you've had the pain. I find that the longer that you've had this pain, the longer it takes to get rid of it. In certain treatments, you need more of them. The less amount of pain. You may not have a plantar plate tear, and we'll talk about that. And then what treatments have you tried? Have you already tried like a walking boot? Have you already tried icing, anti-inflammatories, or haven't you tried anything at all? So let's go into some of these treatments here. After we talk about the plantar plate, what in the heck is the plantar plate? Well, let's start looking at this image here. If you look at a foot, it has this joint. This is called the metatarsal bone and the phalangeal bone. Basically, this is the toe, and this is how it's attached to the foot. And these are the toes right up here. And what happens is it's kind of like reins on a horse. If you think about it, so you have a horse, and you can pull it to the right, you can pull it to the left. And these little reins are these collateral ligaments. So these collateral ligaments are what kind of hold everything in alignment. But we see a lot of feet that look like this picture on the bottom where the toe kind of takes either a right or a left hook. And because of this, there can be a little bit of a tear. For example, if there's a tear, see this area of red right here? If there's a tear on this side, it's going to drift to the other direction. And that's kind of like, that's the plantar plate ligament. It's a ligament that everyone has. And what it does is it holds down the toe. If you don't have that ligament holding down the toe, it's going to possibly lift. Or if you have a hammer toe, that's going to cause it to get inflamed and injured. So once again, looking here, a normal toe at the metatarsal phalangeal joint. This is the plantar plate. And this is where the tear can happen. It can either be a lengthwise tear or a sideways tear. Very common condition. A lot of times it's misdiagnosed. There's a lot of other things that it can be. But what can cause a plantar plate tear? Well, you could start out as a hammer toe, for example. You could have a hammer toe, and then that eventually could tear the plantar plate. Usually they're not totally torn like this. Usually they're partially torn. It could be a dropped bone, a dropped metatarsal. It could be a painful callus. There could be other types of things in there, but you can see the anatomy. Most common are like a long metatarsal, like one of the bones is a little bit longer than the others, repetitive stress, and a hammer toe. Those are kind of things. I see this on patients as well that don't have hammer toes as well. The diagnostic exams, there's an exam that we do. It's called the Lockman test, basically where we grab the toe and we try to lift it up. And if there's pain down there, that's kind of a good sign that there could be a plantar plate tear. It's kind of hard to see. A lot of times we'll do an ultrasound to see if we can see an actual break or effusion, which is kind of swelling around the area of the plantar plate, which would be a little bit forward right here underneath the metatarsal head. Sometimes you can see a little sway on the x-ray. So if it sways to the one direction or sways to the other direction, that could indicate a plantar plate tear. A lot of times we can get a either ultrasound or an MRI. The problem with it is MRI, they have different cuts when you talk about cutting through the bone, and you might not be able to see the plantar plate if you're doing the MRI. So if you only want to watch up to here, this is kind of what I call the plantar plate tear checklist. I like to use checklists in my office. It helps me to explain the treatment options. I'll go over this. If you want to stop after this, that's fine. Otherwise, I'm going to go into a little bit more depth on each of these. So when patients come in, originally we do some type of imaging. Usually it's an x-rays to start, and then an ultrasound, and then an MRI if it's not getting better. The traditional treatments, I always start kind of over here versus over here. So let's talk about this. You want to reduce the stress and strain. So if you have a painful metatarsal, you can do a metatarsal pad. I'll explain what that is. You can strap the toe or pull the toe down, doing a supportive shoe with a cushion. We'll go over some options. You can do custom orthotics to take the pressure off of it, a walking boot to rest it. You can do physical therapy. It doesn't help too much unless it's caused by some other things. Home therapy, stretching sometimes can help if you have a especially tight calf. Reducing the pain or repairing it. So reducing the pain can be done with a cortisone injection. Be very careful if your doctor wants to inject your joint. It very commonly can actually weaken it and cause a hammer toe or cause other types of problems. We don't do too many cortisones, hardly any now in the joints for plantar plates. Now normally the plantar plates happen on the second. I guess it could happen other places, but I normally see it on the second toe. Anti-inflammatories can help. Icing, we'll go into more details. And then if things aren't progressing, then doing some type of regenerative medicine, and that would be either Shockwave, amnio, or PRP. So those are kind of the ways that we treat plantar plate tears. And then eventually, if things don't get better, you could do surgery or get a second opinion. So you can stop here. Otherwise, I'd recommend you keep listening. We're going to go a little bit more. How do we reduce the stress and strain? So basically, if your foot is overly collapsed, we'll do an orthotic. And specifically on that area of pain, we can do a cutout in the orthotic to offload that area. And we use orthotics mostly to help stabilize your posture. And then that can help stabilize and make your foot work better so there's not too much pressure on that area. Once again, if you have a frank tear, an orthotic isn't going to resolve everything, but it's part of the kind of the process as we're diagnosing it and figuring it out. Shockwave therapy, even though it's done on the heel, we use it a lot on the forefoot. There is both, this is called a radial shockwave device, and we also have a focused shockwave device. Both of these are used to help naturally either repair the tissue or reduce the inflammation. Sometimes this can actually be used to take something that's more of a chronic inflammation, and it makes it more acute or more of a new problem, and then it gets more blood flow, and then your body can heal itself. Sometimes we can do that with a plantar plate just with Shockwave, but sometimes we need to use an adjunct of like platelet-rich plasma or amnio or something else like that. I recommend if you have pain like 8, 9, or a 10, I'm going to put you into a walking boot, but if your pain is less, like 5 to 8, I'll probably recommend doing Shockwave for you. This is an example of amnio. I don't do cortisone injections too much, but this would be like an amnio injection. You would find the area of inflammation on an ultrasound, and then you inject it right in that area. And then you would tend to put a patient in a walking boot to really rest it. If you're going to be investing all of that into your foot, you want to rest it and repair it. Certainly anti-inflammatories can be used. I usually say you try it for a week or two, and if it's not making it better, doing it long-term probably isn't the best way to go. If you're doing Shockwave, you can't do any anti-inflammatories during that type of treatment. Icing or contrast baths can help. You can ice the area, but once again, after a week or two of icing, if it's not better, icing probably won't cure a plantar plate tear. Contrast bath is kind of a neat thing if you've never tried it. It's 5 minutes in ice water, 5 minutes in hot water, and then 5 minutes back in ice water. Doing that contrast can help. It's kind of like rebooting the computer. It helps for a lot of things. Reducing tightness. A lot of my patients with plantar plate tears or pain in the front of the foot, they have a really tight calf or something called equinus. And so a lot of our focus is actually loosening the calf muscle to reduce the forefoot load, the load in the front. That might be with physical therapy, could be with PT. They tend to do Graston technique or some other type of therapy at home using this is kind of like a lacrosse ball, foam roller or something else like that can help reduce the forefoot load in conjunction. There are different types of pads. If it's basically only a hammer toe, you can pull it down with this splint. This is called a boot-in splint. You can get these on Amazon. Here is a metatarsal pad, a gel pad that can be done, and this is also a metatarsal pad. This pad is actually stuck in your shoe or whatever you're wearing, and it offloads that area. That can reduce some stress in the area. And then for patients that have a lot of pain, once again, 8, 9, or 10 pain, I'm going to be putting you into a walking boot probably. And then always, if you're seeing someone else and they gave you a boot without this thing, it's probably going to throw your hips off. So I would get an even up. Once again, you can find that on Amazon. Sometimes we do taping. Usually PT does that. A good supportive shoe can be helpful. There's a lot of different brands. Just be aware. I like to use more of an anatomic shoe, like an Ultra or a Topo. If you need a lot of cushion, I would recommend a Hoka. Those are just some brands you might want to consider for this. Tell a word to you that are listening. If you've tried 10 shoes and nothing makes your foot better, the problem probably isn't your shoe. So don't just try another shoe. You should probably see someone. And then the advanced treatments, some of my patients need these more advanced treatments, and we'll do these usually in combination. So we'll do Shockwave in combination with amnio or platelet-rich plasma. These are healthy and safe. You can put them around the joint, and that can be helpful for conditions like this. Okay, and then as a last resort, if none of these get you better, we may consider doing a surgery. This is the most common procedure that I do. It's a plantar plate repair. What we actually do is we shift the bone back. We do a cut right in the metatarsal, and we shift the bone back. We repair the bone after we repair this tear. So we fix the tear in there and reattach it to the base of the toe. There's a recovery about 6 to 8 weeks with this. Responds well. You tend to have to stay off it for a period of time afterwards, or at least be in a walking boot, depending on your surgeon's preference, but that works very well. So once again, going back to the plantar plate checklist, I like to use this checklist so you could see kind of where you're at, what you've done, what are some options for you. And then if things don't get better, you may want to get surgery or consider a second opinion. So I hope you found this helpful. There's a lot of great resources here on drpelto.com. Thanks. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.